Hi everyone and welcome to Doc's Thoughts. So today I'm going to talk about sex drive and libido. It's one of the things I ask every new patient when they come into the clinic if they are sexually active. We talk about their sex drive, their libido, any problems they're having, and we address them if needed. A lot of patients come to me thinking, hey Dr. Wagner, I need my hormones fixed. Let's get my hormones fixed. And while that's an important thing to consider, I want to talk today about all the other things you need to think about beyond your hormones that might be affecting something like your sex drive or your libido. So starting with things like stress. So in the last couple of years, I've had a huge increase in the number of people who are having lower libido issues. And I'm seeing it as a direct result of our collective stress that we're experiencing with the pandemic and the social situations that are going on. So stress will directly affect your libido. The reason it happens is that your body is super intelligent and it knows that if you're under a period of intense stress, especially if it's chronic, it should not reproduce, it should not make a baby because you can't take care of a baby if you're under a lot of stress. So your body is super intelligent. And it's the same with infertility. We see people who are struggling with infertility and they can't get pregnant, and then when they decide to stop trying so hard and they kind of relax, they get pregnant. So it's the same concept. So stress is super important. And as you guys know, it's not always about removing the stress in your life. It's about changing how you react to it and how you deal with it, which is a whole nother topic. But that's the way to approach stress. And then other things that to think about when it comes to libido are really simple things. So think about your relationship with your significant other. If you don't have an open, loving, heart-to-heart relationship, if there's a lot of conflict, if there's a lot of badgering and bullying, you're not going to be able to be fully available for that person and be intimate. So that's going to directly affect your libido. So if that's an issue, that might be where you want to start working rather than looking at your hormones. There's certain things like chronic disease and aging. So aging is a normal process. We're going to lose our hormones as we get older. And so you will experience a subsequent lowering in your libido. There are ways we can boost it with things like replacement therapy, but it's also very natural for it to go down a little bit. So we don't need to feel the same at 50 as we did when we were 18. That's totally normal. And then chronic diseases, if you have a chronic disease, first of all, we know that a lot of them are either reversible or greatly improved by lifestyle changes, which I'll come to. So it might be a good reason to look at yourself and say, hey, am I suffering from a couple chronic diseases? Might it be best to work on my lifestyle if I really want to have that healthy libido that I used to have and I miss it? So it's kind of a good red flag to look at. And then things like prescription drugs or even, alcohol or street drugs can affect your libido as well. You have to weigh the risks and the benefits when it comes to prescription drugs. For example, if you're someone who has severe depression and your antidepressant affects your libido, you're probably better off not being depressed than having a high sex drive. So you really have to weigh the risks and the benefits. But when in doubt, or as always, try to reduce the number of toxins you're putting in your body as much as possible. And the same goes for alcohol and obviously for street drugs. Those will directly affect your libido. And then last couple things, think about self-love. So this is an important concept that we don't talk about a lot when we're talking about hormones. But if you don't love yourself, how could you accept love from someone else? So self-love is a really, really important part of having a healthy sex drive. It's loving yourself, it's loving your body, it's loving your energy and your personality. And then you can transmit that to someone else. And then lifestyle, you guys know I always talk about lifestyle. If you're not eating a fairly healthy diet, getting good sleep, moving your body regularly, dealing with all those parts of a healthy lifestyle, that will directly affect your hormones in a lot of the ways that we already talked about. So that's really always a really good place to start. So with that being said, is it important to change your hormones, take hormone replacement therapy when necessary? Yes, I do it every day with my patients. Is it the only answer for things like low libido or other hormone issues? 100% not. You have to look at the whole picture. And I hope this helps you guys if you have any issues with your own sex drive or any other hormone imbalances in general. Just kind of take a look at all those things we talked about and then start making small changes and you'll notice a big difference. Talk to you soon.